Hello, welcome to my podcast and my YouTube channel. Today, we're going to talk about the topic of the moment. I know I've had one other episode about anxiety before, but I think anxiety is the number one thing that everyone is talking about since COVID, and it's still going on. But even before, I'm going to have a very special guest here with us today. His name is Dr. Judson Brewer or Dr. Judd. Many times that's how I see him. I've seen his wonderful TED Talk, A Simple Way to Break a Bad Habit. And this is why I wanted him to be here with us today. He has a different view of anxiety, and that's what we're going to talk about today. He is a psychiatrist, neuroscientist, and associate professor at the Brown University School of Public Health. Also, the director of research and innovation at the Mindfulness Center and executive medical director at Share Care. A lot of titles there. Believe me, I could go on and on and on if I used all the titles he has. But actually, what brought him here for me was his book. I just finished his book called Unwinding Anxiety. It has a long title. New Science Shows How to Break the Cycles of Worry and Fear to Heal Your Mind. I loved your book, Dr. Judd. Thank you so much for being here with us. My audience needs to talk about anxiety because I have mentioned to you, I wrote very briefly to him an introduction. My audience, we have on one side people who are struggling with suicidal ideation and suicidal thoughts. So, of course, anxiety is very high on that side of the audience. But on the other side, we have families and loved ones who are grieving the loss of a loved one by suicide. Many times they are anxious that it's going to happen again in the family, or they even have family members who have attempted before. So anxiety is very, very crucial to be tackled for my audience. And I'm so happy that you're here. Thank you for saying yes and for talking to us today.
No, it's my pleasure. Thanks for having me.
Let's start by giving my listeners this new idea that you bring in, especially because you are a doctor, you are a psychiatrist, and usually what we see when we talk about anxiety and we go to a doctor is this is what the medication is, come back in a few days. And you
Mhm.
come from a very, very different perspective, and one that I totally agree with, I have to say. And you look at it as a habit and something that can be broken. It's a bad habit that we can look at, be mindful of. So, can you just give an overview? Why tackle it from this different perspective? Was this just a natural consequence of what you saw in your office?
Well, one thing that I saw in my office was that I was getting anxiety with treating my own patients for anxiety because
Mm,
if you look at the best medications out there, there's a term called number needed to treat, which gives us a sense for how well a treatment works. And I have to treat 5 patients for one person to show a significant benefit from medications. That number needed to treat is 5.2. So one, I was playing the medication lottery because I didn't know which of the 5 patients was going to benefit. And then also, I didn't know what I was going to do with the other 80% of the folks that weren't showing a significant reduction in symptoms. So, as luck would have it, my lab was studying mindfulness-based training programs for smoking and for overeating. So, for example, we'd done a study where we got 5 times the quit rates of gold standard treatment for smoking. We'd done a study of this Eat Right Now app where we'd gotten 40% reduction in craving-related eating. And somebody in that program said, I'm noticing that anxiety is triggering me to eat, to stress eat. Can you develop a program for anxiety? And I was thinking, I prescribe medications, I'm
mm,
not sure that I'm the right person for this, but it put a bug in my ear to go back and look at the literature to see what I had missed. And something that I didn't learn in medical school, something I didn't learn in residency, but an idea that was put forward as early as the 1980s was that anxiety could be driven like a habit. And when I read that and looked at the literature and then looked back at my own patients and my own life, it made a lot of sense, and I also thought, well, I know how to work with habits. So can we develop a program that tests this? And long story short, we developed this Unwinding anxiety app and tested it in several clinical trials. One with anxious physicians where we got 57% reduction in anxiety. One with people with generalized anxiety disorder, and we got a 67% reduction. And there we could calculate the number needed to treat. And that number needed to treat, so remember for medications, it's 5.2.
Hmm.
That number needed to treat was 1.6.
Wow.
Yeah. So that's what really kind of got me into looking at this from a different perspective. What was I missing? And could we take a mechanistic approach? Could we approach this from a mechanism standpoint rather than something that's wrong with somebody, and then see if that works? And it seems
Hmm.
to work pretty well.
Wow, it does. The numbers are great. And you mentioned in the beginning, you said, I was getting anxious with my patients who had anxiety, right? And I feel the same. I have one client that we've been together for over a year and very anxious. And many times I would bring it into supervision because I say, but when by the time I finish the session, I am so anxious. And this is a very important point, actually, because it's contagious, isn't it? There's
Yes.
nothing for human beings, there's nothing more contagious than mindsets and emotions, because we have those mirror neurons that pick up on feelings and emotions. And we've been talking about contagion for what, over a year now because of COVID. I mean, that's contagion right there. And that's a very good reason to treat it, isn't it?
It is. There's a term, there's actually a scientific term for it called social contagion, and where you can get vaccinated so that you don't get a virus. Somebody can sneeze on your brain from anywhere in the world with the social contagion. And with social media, there's a great petri dish for spreading anxiety and fear and panic, across the world.
Hmm. Yes, and when you talk about habits, it is contagious. And I've also known, I have quite a few friends who are very anxious. They're very conflict driven because you have to keep that adrenaline running all the time. And what I feel is that if they are not, that's their comfort zone. If
Mhm.
they are not anxious, they don't know what to do because it has become a loop, right? So how can we break this loop? One of the things that you bring into your treatment, and I think it's the central part, is mindfulness. That's another buzzword, right, that we've been hearing for a few months, few years now. What is your concept of mindfulness, and how do you bring it into treatment?
Yes, I think mindfulness can mean a lot of different things to a lot of different people. So I like to keep it very concrete. And you can think of the elements. What makes up mindfulness? Well, there's awareness, and then there's an attitudinal quality of non-judgment, or I like to think of it as curiosity. So we can be aware of something and we can really be curious, where we're bringing a fresh look, fresh eyes. We're not assuming we know what's happening. That's what mindfulness is all about. And with that, it helps us start to illuminate our minds, where we can start to see what's happening in our minds where we might not have noticed that before.
Hmm. What about in the body? You're talking about the mind, and this is a very common association we make. Feelings, emotion, they're all in the mind, and we know that it's not. I mean, it's in your whole body, and it's expressed everywhere. So, one of the things that you talk about when it comes to mindfulness is to notice where it is in your body. So, can you give examples? Because we are not brought up to get in touch with our bodies at all, right? In Western society, no, emotions are in the mind, and that's where we feel it, quote unquote. But can you give examples and help my audience maybe tackle that and identify where it is in the body?
I'd be happy to. So here, it's as simple as asking ourselves this question: where am I feeling anxiety right now? Where do I feel it most in my body? Because our brains don't actually have sense neurons. Our brains, you can do surgery on a brain without anesthetic because our brains don't literally don't feel anything. So
Hmm.
it's really about, where do I feel anxiety in my body? And we can just ask that question as a way to start to bring our awareness into our embodied experience. And then we can start to notice where we feel it.
Hmm. So some of these, I mean, how do you feel it? Is it like your breath is different, more shallow? Is it connected to the heartbeat?
I can tell you personally, when I'm feeling nervous or anxious, my shoulders tend to get tense, a little tighter, breathing more shallowly or more rapidly. There's a restless quality in my experience. Sometimes there's heat. Sometimes my jaw's a little tighter. Sometimes even my eyes are a little kind of more
Hmm.
narrowed. And then when there's, I used to have panic attacks. I would get those during residency, and there, it's full on, where racing heart, feels like I'm going to die, shortness of breath, those types of things.
Yeah, for me, one of the things that I feel immediately is the change in temperature.
Hmm.
My body, I heat up. I can feel that my temperature rises.
Hmm.
I think it's the first thing that I feel. I mean, there's the breathing too. Heartbeat, not so much. So it is different for different people, isn't it? So that's why it's important for you to notice. Is that it?
Yes. So it's not only important for us to notice it so we can see if we're anxious. So, for example, I write at the beginning of my book how I didn't even know that I was anxious
Mm.
in college, and thought I had a GI bug, where because my intestines were trying to tell me that I was anxious, and I was thinking, no, I must be infected with something from backpacking.
Yeah,
So yes.
I actually interviewed someone who in college was feeling quite the same too. And he said the same thing. So I didn't know it was anxiety. He was having something in the stomach too, and sleep
Hmm.
deprivation, couldn't sleep. But, and I'm sure for doctors, oh my goodness, I don't know how you guys do it, how you go through medical school and come out of it alive. Really. It is the number one, I think, pressure driven program, isn't it?
Well, we're certainly taught, like you were saying earlier, to not pay attention to our bodies and not pay
Yeah,
attention to our needs.
yeah, yeah.
Very much a martyr-driven profession. It's where it's like,
Hmm.
I shouldn't be taking care of myself because I could be spending that time, taking care of my patients.
Yeah. And when we do talk about let's do self-care, that's another buzzword right now. Everybody's talking about self-care, and let's take care of ourselves. And okay, I'm gonna go for a walk, which is great. But we focus on the physical body,
Mhm.
but we don't focus on being present many times, because you do walk, but you're looking at your screens. And the one topic that I think is very important for my audience, Dr. Jad, that I want to hear your view on is the link, the association between anxiety and addiction.
Mhm.
Because many times anxiety brings us, it's so hard to deal with it, and we don't know what to do with it. We distract, and then we self-medicate with alcohol, with drugs, with whatever, overworking, whatever that is. So,
Mhm.
what is the association? What do you see in research?
So there is a 100% overlap here, in the sense that they're both driven by the same process. So this process is actually set up through how we learn any type of a habit. There's a trigger, a behavior, and a result. So you can think of, uh, if we're anxious, that's the trigger. The behavior could be that we start drinking alcohol, or we overeat, or we stress eat, or we turn to social media. And then the result is that we feel a little bit better because we've distracted ourselves from that unpleasant feeling of anxiety. So not only can anxiety drive unhealthy habits like drinking, and I write a little bit about one of my patients in my book who came to me, he was referred for alcohol use disorder, but his underlying issue was really anxiety. So that's one piece. But then we can also see how anxiety is driven just like any habit. So, where an addiction is perpetuated through a trigger behavior reward process, anxiety is driven the same way. So anxiety triggers mental behaviors such as worrying. Worrying then has the results of making us feel like we're in control, or at least that we're doing something, about the anxiety. And then unfortunately, that feeds back and not only drives us to worry more, but it also feeds the anxiety, because it doesn't solve the problem. It just makes us feel more anxious.
And then that's what you call the worry loop. and then
Yes.
you get caught up because yeah, anxiety is something that the way we see it is something outside ourselves that comes in and brings up the anxiety. It causes the anxiety, so it comes from outside, but we are not used to thinking, okay, but once it settles in, does it become a habit or not? And that's where our responsibility comes in, isn't it?
It is. And I'll just add I have a lot of patients in my clinic who come to me and they say, I just wake up in the morning and I feel anxious and they can't figure out what it is that triggers it or drives it. It's just this feeling of anxiety that comes up itself. And I'm sure everybody's experienced this. I've certainly experienced it quite a bit where it's just like, I'll be driving in my car, walking down the street, and then I just, this feeling of anxiety pops up. So the anxiety itself can be this piece that drives the worry and then feeds back to drive more anxiety. We don't necessarily need to have some external trigger for the anxiety itself.
Mhm. One thing that's very to me was very interesting that you talk about is when you do this mindfulness, be conscious and be aware of what's happening and develop curiosity about what's happening. Don't focus on the why. Is
Mhm.
that what you just said? I mean, don't focus on why am I anxious? Because again, it drives the anxiety and the worry back. Again, if you keep stuck on that loop of why and why am I anxious? You don't really go to the next step. Is that it? Because I thought that was so interesting. It's a very because we usually, I mean, you even just mentioned right, trigger, behavior, reward. That's
Yeah.
the cycle. So. Um, and that's what where I was curious is so the trigger is why, but no, you say no, don't focus on that. Focus
Yes.
on what you're doing about it and how you react to it. That's why you say what you say.
Yes. I know as a card carrying psychiatrist, this might sound a little heretical that I wouldn't, focus going back on somebody's childhood or something like that.
Yeah,
But
yeah.
the idea is that to change any habit, it's based on what we're doing right now that
Mhm.
is rewarding to our brain that keeps feeding back and driving the habit. So the trigger is the least important piece here. It's really the behavior. So if it's worry, we need to focus on the worry and not just worrying, like not just telling ourselves to stop worrying. If that worked, boy, that'd be great. Every patient that walked into my
That
office, I
would
would just
be easy.
stop worrying and then we'd be finished. It'd be one session. But it's really our brains work based on how rewarding a behavior is. And so that's where I have folks focus is, okay, if you're worrying or if you're procrastinating or if you're stress eating, what's the result of that? And I have them bring awareness in there to see what they're actually getting from it, where they can ask
Mm.
simple questions like, what am I getting from this? Is it keeping my family member safe if they're worried about that? Is it solving the problem if they're worried about that? Is it actually predicting the future? Because typically worry is about something in the future with
It's
an
usually
uncertain
future,
outcome.
yeah.
Yeah.
Hmm.
No, we generally can't predict the future. I don't know about you, but my crystal ball has never worked very well.
Mine
Right.
doesn't either. And
So
believe me, I've tried.
I know. So it's really about focusing on what the result is. And as we see that worrying only feeds back and drives more anxiety, it helps us start to become disenchanted with the behavior. That's what awareness is. That's what mindfulness is all about, is asking, really looking at that cause and effect relationship. What am I
Hmm.
getting from this? And as we do that, we become less excited to worry in the future. And that's the first step in helping us break that cycle of anxiety and
Hmm.
worry.
I love that question. What am I getting from this? Because I'm sure that many listeners are now going, what? Are you kidding me? I don't get anything from being anxious. So, can you give us an example, a practical example of, yes, we always get something from emotions, from sensations, even if it's the reward of keeping the cycle alive, right?
Mhm. So you bring up a really important point, which is when I have my patients look at their worry, they pretty strongly say, I can't see how this is rewarding. Yet it was set up typically as a habit sometime in the past. And so whatever that rewarding quality was perpetuated to the point where they just habitually worry now. So, for example, the worrying could be, let's take a parent, for example, whose child just got their driver's license and they went out with their friends, and the parents sitting at home completely out of control. There's nothing they can do to keep their kids safe. but it doesn't stop them from doing something, which is they start to worry.
Hmm.
And that worrying gives them, it occupies their mind while their child is out. And then they start
Having
to
the
associate.
best time of their lives, by the way.
Right. The parent is sweating and freaking out. And at the end of the night, they hear the doorknob open and then they associate worrying with their child being safe. It is completely false. Worrying does not keep their child safe, yet their brain starts to make that false association. Oh, I worried and my child came home safely. So that just gets perpetuated as a habit because they're not paying attention. They're not really checking to see, is this worrying actually keeping my child safe?
Yeah. Also, you mentioned procrastinate. I mean, that if you think that, again, it's the same idea that you just mentioned. I have never solved a problem by worrying, right? By
Mhm.
procrastinating. So yeah, just get down to business and get something done, and that will take the worry away, right?
Yes, it does. And that's, that comes back to these neural mechanisms about how our brains work. If our brains can see that the worrying isn't fixing or solving the problem or getting the project done, or the procrastination, as you point out, we can see, oh, this is really isn't helping me. What does it feel like when I actually get the project done? Or what's it like when I don't worry about my child? Oh, I have a much better evening. So,
Mm-hmm.
my child has a good evening and I have a good evening, as compared to them coming home saying, mom or dad, what's wrong? You look really, you look really anxious.
Or they scream at their kids because they're 2 minutes late, right?
Right. Right.
You mentioned in your book a lot of examples, and I highly recommend his book, and I'll have all your links on my notes. But you mentioned, for example, because you do a lot of studies with smoking, right? And when you talk about awareness and bring awareness to what you do, and actually, I was thinking, because back then in my 20s, when I went to a party, I would smoke. And then it's funny, back then I did that. I started paying attention and actually visualizing. And I
Mhm.
would one day I just stopped and think, what am I doing? And I started visualizing the smoke going to my lungs and all those toxic, toxic stuff that's in cigarettes. And I said, what on earth am I doing? But when I read on your book, you mentioned some of the examples of them. Okay, I'm
Mhm.
going to really pay attention to me smoking and the smell, and how because you actually feel it going into your lungs,
Mhm.
and that changed everything. So, and why I'm bringing this example is because, again, addiction is very important for my audience. So when you do grab that drink, pay attention, what are you doing, right?
Mhm.
What does it again, what is it bringing to me? So that helps with addiction too. You see that it helps with your clients.
Yes, we've done a number of studies now. We did our first study I did when I was in residency. We had looked at alcohol and cocaine use disorders and found
Mm,
that mindfulness training helped prevent people from relapsing to drinking or using cocaine. I think, as I mentioned, with the smoking, we got 5 times the quit rates of gold standard treatment. So with addictions, helping, and I do this work with my addiction patients with addictions in my clinic all the time, is I have them really look at the consequences of drinking. For example, I'm thinking of a patient that I just saw yesterday who, when she's intoxicated, she can't, it's hard to pay attention because she's intoxicated, but right afterwards she can really pay attention. And when she notices that she drinks alone, for example, triggered by feeling bad or something like that,
mm,
it doesn't solve the problem, and it makes her feel worse. Actually, drinking makes her feel anxious. And so when she can look at that clearly afterwards and then kind of lay that down in memory, it makes it easier for her when she has an urge to drink in the future to recall, what was it like the last time I did this? And that recollection helps her see, oh, it actually it wasn't that great. And it helps her not drink in the future. I'm thinking of another one who has been sober now over a year. And every morning she wakes up and she just compares, what was it like when I drank versus what is it like right now when I'm sober? And for her, it's a gazillion times better. to be sober. And that helps her stay that way every day, just from that recollection.
Uh-huh. Yeah. Yeah, I'm thinking of friends who wake up. I have a friend of mine who has a very bad addiction with alcohol, and it's one of the first things he does in the morning. And again, I'm sure you hear this all the time. They say, "Well, but we know drinking is not good." But again, it's about the habit itself. Yeah,
Yes.
but do you even stop to think what you're doing? That you're going to grab that drink and you're going to drink it before you do it, or even during? Do you actually stop and think? And are you mindful of what's happening right now, of what drove you there? What is the reward, if there is a reward? Because as you just mentioned, now she's feeling, but now there is a reward because she stopped drinking, right?
Right.
So again, we go back to mindfulness as a way to you really pay attention and not just go straight to the habit loop.
Yes. And
Okay. Okay, go ahead.
I was just going to say, and we can bring awareness when we're in the habit loop. We can map these habit loops out. We can see them in real time and just keep asking that simple question: what am I getting from this? What am I
Yeah.
getting from this? And look
Can
at
we,
all the
yeah,
results.
can we give an example of a very practical example that I think is, to me, an epidemic in itself, which is the habit and the horrible addiction to screens,
Hmm.
where most of us have some level of addiction to that, because that's how they're programmed. That's what they're programmed to do, to keep you hooked on those phones. And we know that it's affecting, I'm sure you see that in your office every day. I do. It's affecting relationship connections. You have this illusion that you're connecting more, but you're not, because that's not real connection. So can we go through the loop there? What do you
Yes.
see, and what would be the loop of always having to check your phone, for example?
Yes. So I want to highlight one piece of science here that people might not notice. And I'll use, there's so many examples, but I'll use news feeds as an example. So in the past, before smartphones, people had, and before the internet, there were, it was like the evening news and the morning newspaper. I used to be a paper boy. I used to deliver the morning newspaper.
You
Okay.
did?
Yes. so
We don't
so
have
I
that in
would
Brazil, but I always saw that in movies.
okay, yeah. I would ride my bicycle around the neighborhoods and try not to wake people up as I threw their newspapers at their front door. And so it was, you would get a news source, and it was generally trusted, right? Because it wasn't all sorts of people just spouting anything. It was actually, the reputation of the newspaper was at stake, and so they had to report accurate news. So you get the news in the morning, or you get it the evening news on the television, and that was it. Now we can go anytime to get news. And so let's imagine that we've got a news site and we check the news. There's nothing new, nothing new, nothing new, nothing new. And then suddenly there's a news story. Well, that is no different than somebody playing a slot machine where they pull the lever, pull the lever, pull the lever, and then suddenly they win. So, just with news cycles as an example, but this is true for all of social media. If we're constantly checking, we're actually setting ourselves up to be addicted through a process that's called intermittent reinforcement, which is the strongest type of learning known in all of science. Meaning, basically, you're getting a random reward. You don't know when you're going to get new information. With social media, you don't know if you're going to get a like or when you're going to get likes. All of this is set up in the same way, which is to really capitalize on how our brains learn. This learning process was just set up to help us remember where food is. Yet, with these weapons of mass distraction,
Hmm.
you know, they're set. We basically have a slot machine in our pocket that we pay for. so, so a typical habit loop would be somebody is bored, for example. So the boredom is the trigger. The behavior is to go check their social media. And then the reward is that they get to scroll through their Instagram feed or whatever their social media account is that makes them less bored for a moment because, oh, they're checking to see if there's something new. That feeds back to the next time that they're bored where their brain says, oh, I know what to do. Let's do this again. Let's check our social media again.
So what is the answer there? You say bring in a new reward. What would that be? Give us examples.
Yeah. So the first thing that we have to do is see how unrewarding that process is. I'll give a concrete example. I was working with a resident physician who was, training to be a psychiatrist, and she was starting. I was having her use some mindfulness practices, and she was actually using testing out our smoking app, our Craving to Quit app. And so as she was using that to learn the concepts, and one time it was dinner time. She had two small kids, and she realized, she kind of woke up in a moment where she was just on autopilot, checking her news feed. This was at dinner. She was standing
Wow.
away from the dinner table. Her kids were having dinner, and she was checking her
Ah,
news feed.
that
And
drives me nuts.
she said, "What am I doing?" And she just got totally disenchanted with that process because she saw it so clearly, the negative effects of her not connecting with her kids at dinner over checking her news feed. So that's the first step, is recognizing what we're doing, and seeing how unrewarding it is. That's why I like the simple question, what am I getting from this?
Mm-hmm.
And it's not an intellectual exercise. It's not like, I know, because we all know that smoking and overuse of social media and all this, they're all bad for us. We know that they are. This is not an intellectual exercise. It's really feeling into our experience. Like the example of my resident, she really felt that gut bomb.
Disconnection. The
Yeah.
disconnection, right?
What am
Yeah.
I doing? That helped her to get disenchanted. Once we get disenchanted, in my book, I call this finding the BBO, the bigger, better offer.
Mm-hmm.
So here we give our brain something better, but not just something else that drives the same process, but something that's intrinsically rewarding. Things that are intrinsically rewarding tend to come in two flavors. I think of them as curiosity and kindness. So, for example, with the example of the resident that I was talking about, she knows how much better it feels to be connected with her children than to be disconnected. And so there's a natural reward there that she can just pay attention to, notice how rewarding it is, and that will naturally move her in that direction. That's the nice thing about awareness, is that it's the beginning, the middle, and the end is all dependent on awareness. We see these habit loops. We start to see how unrewarding the current habit is, and then we see how much more rewarding that the new behavior is, like checking social media versus being connected with our kids. So that's the whole process. You need awareness to map it out. You need awareness to see how unrewarding the current behavior is, and awareness itself, it can be the new behavior. Think of curiosity. Curiosity feels much better than anxiety, for example. And so awareness can even be that bigger, better offer.
Yeah, I love when you talk about curiosity because I talk to my clients all the time about being curious about the emotions they feel. Because again, we're brought up listening, hearing this thing. No, no, just forget about it. Don't feel it. Don't cry. And I said, no, if you're feeling sad, sit in with it and be curious. Ask yourself, oh, why am I sad? And then it's going to dissolve naturally because emotions, they have a time limit. They're not going to stay there forever. But if you just suppress it and distract and go to your screens and do all of that, it's not going anywhere. So it's
Yeah.
pretty much the same concept, isn't it?
Yes. What I like this saying, what we resist persists, and what
Mm-hmm.
we feel heals.
Wow, I
So,
love that. Yeah.
so instead of running away from something or distracting ourselves, if we turn toward it and get curious, oh, what does sadness feel like? Again, it doesn't
Mhm.
matter what caused it, it's here right now. Oh, what does sadness feel like right now? That naturally awakens our curiosity, that, oh, that's the curiosity. And then
Yeah.
we can start to explore, oh, what does it feel like? And as you pointed out, we can start to see that it comes and goes.
Hmm. Well, before we finish, I want to talk about anxiety, of course, because I don't want, I'm sure that we have listeners now going, well, but I'm diagnosed with anxiety. I've been to the doctor and I take medication, and I do not want people to just finish this episode and go, okay, I'm going to stop my medication. I'm going to be mindful. That's not the way to do it. So I wanted to talk about the diagnosis itself. And of course, this, I don't want them to be too mindful of their anxiety. to the point that they're going to just forget about medication because we know where that leads to. So, as a psychiatrist and a doctor yourself, what would you say to someone who is thinking that?
So here, if somebody's on medication working with a healthcare provider, absolutely, they should keep working with that person. And the way I think of this is, some people can benefit from medications, and I've certainly have plenty of patients on medications. Everyone can benefit from understanding how their minds work. So I tend to bring these two together. If a medication is working for somebody, by all means, stay on the medication. We can start to augment that with mindfulness training. We can train people to work with their minds. Importantly, it's not just about paying attention to your anxiety, because a lot of folks are like, well, I pay attention and it feels really bad and it makes my anxiety worse. So it's really important to have a good evidence-based program or work with a therapist who's trained in mindfulness if somebody's going to go that route, so that they can be guided into how a mindfulness works and how it's supported. So for example, with our Unwinding Anxiety app, we actually have an online community that I moderate. I go on there every day so people can ask questions if they're struggling with the concepts, or they're falling into the trap of just like, oh, I'm paying attention to my anxiety, it feels worse. Well, that's not really what mindfulness is. And I can help guide them in a better direction. So here, if somebody's thinking about mindfulness, if this sounds good, make sure you get an evidence-based program or work with a therapist that really has experience, training with mindfulness. And
Mm-hmm.
of course, if you're on medications, work with your healthcare provider to see what works best for you.
Mm-hmm. Dr. Judd, you just mentioned your app. Can you tell my listeners where to find you, your app? I know you're in so many podcasts, but you have your website, you have your books. So if they want more information, I'll have it all on my notes, but can you just tell them, please?
Sure. The easiest way to find the Unwinding Anxiety app and my book and everything else is on my website, which is just drjud.com, drjud.com. But they can also just download the app. It's available on all platforms. It's called Unwinding Anxiety. But there's tons of information. We've got a bunch of free resources as well on the website.
Any special message to my audience?
I would say, I love this quote by James Stevens, who talks about curiosity. He says, curiosity will conquer fear even more than bravery will. Anxiety has a lot to do with fear of the unknown. And so here, I would encourage folks to really explore curiosity and also kindness.
Mm.
Kindness is so needed in our world
Oh my
today.
God. Yeah.
Kindness toward ourselves, kindness toward others. And both of these are so much more rewarding than getting caught up in our anxiety habit loops or any of our compensatory habits that we've done to deal with anxiety, whether it's drinking or overeating or whatever. So here I would just say, listen, that quote from James Stevens is really powerful. Curiosity will conquer fear even more than bravery will. Keep that one in mind.
Okay, and I want to highlight the kindness part because it starts a much more rewarding and positive loop, right? That's a
Absolutely.
loop that we want to get into and not avoid or get rid of. And I want to end, you ended with a quote. I'm going to end with one of your quotes: make connection the new infection. I love that. Thank you so much for being with us, Dr. Judd. Have a good day. I can see if you're watching on YouTube, behind him, he has a yoga, a place there. There's a mat. So I'm sure that he's going to center himself and ground himself in a few minutes. Thank you so much for being with us. I
My
feel so
pleasure. Thanks for
honored to
having
have
me.
you here.